Have you ever been told your labs are normal, but you still feel exhausted, bloated, foggy, or off? What if the problem isn't your diagnosis, but the fact no one is asking, why? Today, we're answering one powerful question. What is functional health? Functional health is a root cause approach to wellness. Instead of chasing symptoms, it asks why they exist. It focuses on your body's systems working together. Gut, hormones, metabolism, immunity, and stress response. The goal is to restore balance, not mask signals. Functional health versus conventional medicine. Conventional medicine is excellent in emergencies, but it often focuses on managing symptoms. Functional health complements it by focusing on function. It's proactive, personalized, and preventive. It's not anti-medicine, it's pro-understanding. In functional health, everything is connected. Gut health affects immunity, mood, and hormones. Blood sugar impacts energy, weight, and focus. Chronic stress disrupts digestion and sleep. That's why systems are addressed together. Food and lifestyle. As medicine, food isn't just fuel, it's information. It influences hormones, inflammation, and gut bacteria. Sleep, stress, and movement are core therapies, not optional extras, foundational pillars. Small changes done consistently matter most. Who functional health is for? Functional health helps people stuck with answers, especially when symptoms persist despite normal tests. It's for prevention, not waiting for disease, and for anyone who wants real resilience. Functional health isn't about trends or extremes. It's about understanding your body, addressing root causes, and restoring balance, so symptoms don't return. If you want clear, evidence-based health explanations, subscribe to Functional Health Notes. New videos weekly, no hype, just clarity.